Apologize for the small delay. We thank you for your patience, and we also thank all of you who have joined us tonight by telephone, by YouTube or Facebook. We really appreciate all of you. You know, we're back at our weekly meetings, COVID-19 meeting, and we just appreciate everyone. We know that we're starting to, get vaccinated. We know folks are still practicing social distance and staying vigilant and making sure that folks are still, washing your hands when you touch things. So as we go into the next phase of this COVID, we still just want everybody to know that we still have to make sure that we practice what we call precaution when it comes to this COVID, because it's still here. But tonight we are so honored that all of you have joined us. But we have a great panel tonight. You know, we have our guest tonight, Swami Nee, who is from from Doctor, who is from the Professional Medicine, Rutgers, New Jersey Medical School. So Doc, thank you for being here with us tonight. We thank you for your patience also. Also, we have our health officer, Victor. And we thank Victor. Dr. Griffin have another task because we are in our city, around the city, doing vaccinations. So she is preparing to get ready for FEMA. So she would not be joining us tonight, but she has been here with us for the entire year. So with that, again, we thank everybody for being here, our staff and those who have been working hard behind the scenes. Thank you, thank you, thank you. So with that, East Orange, I want to go right into our COVID numbers, because I am excited to have the doctor here with us tonight, who is going to really give us an overview on her perspective when it comes to the vaccine, and it comes to even the COVID, and we're so grateful. We have been really in the forefront here in the city of East Orange, of making sure that we kept and keeping our residents and our constituents up informed in terms of where we're going and the direction that we're going with this COVID. So with that, I want to also thank our chief of our police department, who has been doing an outstanding job with her men and women. And that's no other than Chief Phyllis Bendy, our public safety and police chief right here in the city of East Orange, who joined us tonight also. And listen, it's not her first time being with us on our virtual COVID-19 meeting. She has been here on several times, just giving you an update. But tonight she has some information that she wants to provide with the city to really keep all of us safe. But before we go there and go through our Q&A, let me just give everyone an update. As of today, March the 10th, 2021, we have confirmed 5,541 positive cases in the city of East Orange and 275 confirmed deaths. In the first ward, we have 916 positive cases. In the second ward, we have 921 positive cases. In the third ward, we have 1,061 cases. In the fourth ward, we have 1,008 cases, and in the fifth ward, I'm sorry, in the fourth ward is 1,008, and the fifth ward is 1,135 cases. In Essex County alone, we have 69,930 positive cases and 2,439 resulted in deaths. In New Jersey alone, East Orange, the positive cases are 729,403 and 21,294 resulted in death. So again, we have to continue to mask up, to wash our hands, to practice social distancing. Let's continue to protect ourselves and each other, East Orange. We have to do it. So with that, listen, we're going to go right into our conversation with the doctor, because I know that she has so much to share with us. And then we're going to go right into a conversation with Chief Bendy. Then we're going to allow Victor Cote to give us an update on our vaccine and what days they are and the locations. So again, with that, Doc, thank you so much for being here with us. I know you have so much information that you can provide to those who are watching us on live stream and they're watching us on Facebook and also YouTube. So I'm going to turn the floor over to you, but we are so grateful to have you with us tonight that we just happy.
Well, good evening, Mayor Reed, and thank you all to you for giving me the opportunity to talk to you and your constituents about a healthcare crisis like none of us have seen in our lifetime, and possible way for us to overcome this pandemic in the next couple of months if we can all work together.
Yes, and that is, that is so true. So if so, Doc, please tell us about the clinical trials. Many people are concerned that this vaccine was created too quickly, as they say. Let's talk about that. Let's talk about why people have those feelings in terms of the vaccine and it has been created too quickly. What is that myth?
Absolutely, and thank you for raising that question, because a year ago, I remember having this conversation with my family, and I told my husband, there's no way they're going to get a vaccine by the end of the year. It's going to take time. I said, but it's probably going to be a year and a half. But that was before I was actually involved in the work that goes into vaccine development. So from science, technology has evolved over time significantly to the point that we were able to pinpoint, in order to get a vaccine, you had to figure out what is the best target in the virus to develop antibodies. Can we produce something like that, a vaccine, in a fast enough time from a laboratory perspective? And what does it take in a clinical trial to conduct, to show that it's safe and effective? So for this particular virus, early on in January, investigators were able to pinpoint the part of the virus that was critical in infecting human beings, and it was shown that people who had recovered from that infection had high antibodies. So we knew what we had to do. By the end of January, they developed or you sequenced the virus completely so that we knew, okay, this is what the virus looks like, so let's get into clinical trials. People feel like most clinical trials will take years and years.
Right.
One of the reasons that happens is usually clinical trials enroll maybe like 3,000 or 4,000 people, and then it takes about 2 or 3 years or longer to prove that it's effective, because it will take a certain number of cases in the vaccine arm compared to the placebo arm, the group that didn't get the vaccine. And the second thing is most pharmaceutical companies are developing these vaccines by themselves. So they will never take risks. And there's a lot of paperwork and administrative processes that goes into clinical trials, which all, if any of you have been at work in government, you know what I mean by bureaucracy and things taking time.
Yes.
Because we were in the middle of a global pandemic, the government essentially said, okay, we are going to facilitate a priority on this. We are going to force companies to work together with one another, share scientific information so that lessons learned from one study, one company could be applied to another, so that mankind as a whole can succeed as opposed to one company. And most importantly, the U.S. government invested in all these different companies, not knowing which one would work, and said, we are bearing a financial burden. We want you to focus on the science. And so these clinical trials that were conducted with the same ethical standards as previously conducted, except the study population was 10 times. It might have taken us about a year and a half to prove that it's effective. both Moderna and Pfizer, and then J&J were so effective that within the specified period of time, at 2.5 months of study start, the vaccines were 95% effective. So there was only a 10% chance that would happen, but it occurred because they were so effective that at that point it became unethical to withhold something that was so effective from people that were dying from COVID.
Right.
And last time with respect to safety, most vaccine side effects occur in the immediate period. You know, the vaccine, you give the vaccine, it lasts in your body for 3 days, then it dies out. It goes away, there's nothing left. So it's different from medicines that accumulate in the body over time. And all the safety data, and I'm so proud of the FDA for saying that we must get minimum of 2 months of safety data to show that the vaccine is safe.
Right, and Doc, thank you so much for that. Let me ask a question. I know we just talked about people skeptical about the vaccine that was created very quickly. How can we be sure that this vaccine is working?
The data speak and the results speak for themselves. The way I can tell you with confidence that the vaccines are effective is in the clinical trials that were conducted. And they, both Moderna and Pfizer were 2 studies conducted completely independent. They reached the same result. They both showed that the vaccine was 100% effective in preventing death and severe complications from COVID-19. I mean, and those data, people conducting the study, we don't know who's getting the vaccine, who's getting the placebo. There is an independent board of experts that reviews this data. So they have nothing to do with the company, they have nothing to do with people with the study. They're independent. Their job is to protect the safety of the participants in the study. They look at the data and they say, okay, no, the vaccine is effective because these are the results. And we see that, and all the data are public. So people can look it up, it's out there.
Yes, and that's true. So, you gave a kind of small scenario about the Moderna and the Johnson & Johnson and the Pfizer, because the Johnson & Johnson is out now. Give the comparison. What's the difference between the vaccines currently available, the Pfizer, the Moderna, and the Johnson & Johnson? Can you give that comparison, or is there a comparison?
Sure. So I think the key, they are similar and different. So Moderna and Pfizer were approved in December. They are using a messenger RNA technology, which is a newer technology. But actually, the reason we were able to get that so soon is because the technology eliminates the need for us to work in the labs. It only gives the information that we need to produce the antibodies for SARS-CoV-2, the virus. J&J does something similar, except it uses that, it gives the body that information by coating it in a different virus that doesn't cause infection in humans and adds the virus. They are all approved for adults. Pfizer goes down to age 16 and older. Although all the companies are in the process of very soon will be starting pediatric studies. Pfizer is also going to be conducting a study in pregnant women. With respect to safety, all the vaccines are exposed. The 3 vaccines are extremely effective in preventing severe COVID-19. The one big difference is that both Pfizer and Moderna require you to get 2 shots. The Pfizer vaccine shots are given 3 weeks apart, and the Moderna vaccine are 2 shots given 4 weeks apart. The J&J or the Johnson vaccine is the only one that requires only 1 shot at a time.
Right, yes. Correct. So let me ask this question. How long would it be before we really know the long-term effects of this vaccine?
So people in clinical trials are being followed for at least another year and a half, because long-term side effects of these vaccines, we estimate, are probably going to be extremely rare from what we know thus far. Particularly when you put that in context with known complications from COVID-19, and every day we learn newer, more concerning things that COVID-19, even in people who had very mild infections, there was a paper that came out this week that said that people who had very mild infections, very mild, maybe a little runny nose, cough, even they were having long-term kind of brain fog and difficulty concentrating or other complications. So in that context, COVID-19 vaccines, I think, are still relatively extremely safe. Is there a rare possibility of something remote happening in the long term? Mm-hmm. It is possible, and that's why we are collecting data. Every single person that gets vaccinated is encouraged to log into the CDC website, where you can actually input your data, de-identified data, but you can say how you did, how you're feeling, and report any side effects that we continue to accumulate on this body of evidence that hopefully continues to support the safety of these vaccines.
Right. So, different medicines affect people in different ways. Has it been, and as well as also generically, people have different effects. Have research determined if one vaccine is more effective than the other in minorities?
Thank you for raising that question. I think you raised a very important point, because any medicine that we bring out for use in the general public must be equally effective across the population it's being used for. It is because of that the clinical trials that these vaccines were involved in, we made sure that participants were reasonably representative of the population. And what do I mean by that? Even though minorities were slightly underrepresented, all the clinical trials had at least 20 to 25% of the clinical trial population were Black and brown communities. And when they look at the effectiveness of the vaccine in those groups, the vaccine was found to be just as effective in Black and Hispanic as in white communities.
Yes.
So I think there's enough data to show that it's equally effective across race and ethnicity.
Let me ask a question. If you had to give some advice, would you give, you had to give to someone, who do you feel, because people still on the fence about the vaccination, and if you had to give your advice and from your expertise, what advice would you give people who are on that fence, still on that fence, even though the vaccines are out, the 3 Johnson & Johnson, the Pfizer, the Moderna, all 3 are out now, information has been provided, and people are still, on that fence, like, I'm still trying to wait for these vaccines to get into these people. People are still waiting to take the second shot, and people are still waiting around to see, and we're hearing there's another vaccine coming out. And if you had to give any advice from your experience and your expertise, what would be your advice to folks about this vaccination?
We don't have the luxury of waiting too much longer. For people who are on the fence, I can only give you the numbers. As of Monday, over 300 million people were vaccinated worldwide, including over 90 million people just in this country. Every day, 2 million people, approximately 2 million people are being vaccinated in the U.S. And thus far, there have not been any serious safety side effects reported from the vaccine. People have talked about allergic reactions. Well, guess what? The penicillin is 100 times more likely to have allergic reaction than an allergic reaction from these vaccines. And lastly, the vaccines are being given in the background of a raging pandemic. While cases were on the down a little bit, across the world, we see in areas where the virus is continuing to multiply, without stopping, it's starting to change. So it's almost a race against time to try to vaccinate enough people for us to get enough herd immunity so that we will prevent the virus from actively replicating in the community, because we want these vaccines to continue to have long-term effectiveness, and we don't want the virus to figure out a way to beat the vaccine. If you can, you know what I mean. Plus, you know, as a woman, as a wife, a mother, a daughter, it has given me the opportunity or peace of mind for, you know, to know that my parents who have underlying health conditions, you know, were able to get the vaccine, and they're able to go back and take care of an elderly grandmother. You know, so these are real implications for real life. It will allow us to reconnect back with our families in a way that we haven't been for the past year.
Right. So let me ask this also, because what we're finding out also that you may have a family, maybe a family of 3 or 4, and you know, maybe the wife say, you know what, I'm going to take the vaccine, and there's a possibility the husband say, well, I'm not taking the vaccine, and then maybe 2 of the kids, they're young adults, they take the vaccines. What is the effect behind the wife taking the vaccine, the 2 children taking the vaccine, but the husband say, well, I'm opting out, I'm not taking the vaccine? Are we starting to see a percentage or a trend of families or individuals basically, like again, on that fence with a majority of the family, but then there's another majority of the family saying, nope, I'm gonna opt out? Are you seeing that from your experience?
I mean, not yet, because we're still at the point where demand is far outweighing the supply. So we're still having a lot more people who want to get the vaccine compared to those who don't want to. Plus, most families with young adults aren't eligible to get vaccinated. You know, the only people who are able to get vaccinated right now are, you know, senior citizens, nursing home residents in healthcare centers, people with underlying health conditions, and frontline workers, physicians, and most recently teachers, etc. So we still have so many people who are not eligible to get the vaccine that we still don't have enough information on that. That being said, your unit or your pod is only as strong as your weakest link. So if you still have people within a pod or family, and some who, you know, I can talk about my old nanny. My kids are, you know, 8, but when they were young, we had a nanny, and she was on the fence, but she finally took the vaccine, but her husband was on the fence, and I had to talk to him multiple times, reassuring him, people want to protect themselves. They want to keep themselves safe, they want to keep their family safe, they just want to know that it's okay for them to get the vaccine. So for those on the fence, if you're still unsure after today's talk, I would urge you to talk to physicians and other people who've been involved in this work, who actually know the nuts and bolts about why the vaccine is safe and effective, so that then you can make a better educated decision. I also think it's important for community leaders to start speaking up about this, because my patients trust what I say, but that's only because I've been working in Newark, and I've been taking care of them for over 15 years. So they trust what I have to say, because I'm coming from a place of, I put in the work with my patients, and I've done the work on the clinical trials. So I have multiple different hats when I'm talking to them. So I think people will feel a lot more reassured when people in their community, people in their social circle that they trust, will also start talking about this in a positive aspect, because that's the only way we can overcome this pandemic, is by working together.
Dr. Swami Nathan, right? And I really thank you for that. That was, you know, because people want to hear, you know, so many different perspectives out there, right? What percentage, doctor, you think that we need to be at, right, to put a curve to this COVID, right? And why is it that in the urban communities that we're finding that our numbers are down, right? Why do you think that stigma, you know, is in our communities, such as the urban communities, right? But then we look outside of our community, sometimes you're seeing people going to get the shot. And from your experience and been involved in this dynamics of these pandemics, you know, why do you think that those things happen or are happening?
There's multiple different reasons why I think that has happened. I mean, the past few years have really been very difficult for communities of color. The past couple of decades have been challenging. You know, clinical trials, you know, the scientific community has there's a history of mistrust in the Black community, which is scientists, because of the clinical trial atrocities in the past. That being said, a lot of measures have been in place to ensure that history doesn't repeat itself. But racism still exists in many shapes and forms. There's a lot of data that show that when people of color present to the emergency room, they are probably less with pain, they are probably less likely to get effective pain medications than their white counterparts. So these are facts and these are real things that happen to people till this day. So we have to, as a community, start addressing those things. But at the same time, when you look at the studies that have recruited people, you look at the data and say, oh, well, does it make sense for my community? Did they include people of color? Were Black and brown communities included in these vaccine trials? Did people from my community have serious side effects from these vaccines? And the data show for the vaccines currently that no, people of color responded just as well to the vaccine as white people. That being said, the messaging has to come from multiple different people, not just the physicians. I think they have to be reassured from their healthcare providers, civic leaders, their faith leaders, and average people in the community, because it's going to require that sort of community involvement and engagement to help increase awareness, which is why, I've been willing to talk to, multiple people. I've talked to a lot of churches, many faith-based organizations, talking to people in my community, because at the end of the day, I've been working in Newark for, at this point, over 15 years. This is my community, this area, the underserved communities, what I've been trying to make a difference for. And I will continue to have these kind of conversations with you and anybody else to help try to make a dent in that.
Right, and we really thank you for that. So Doc, I'm gonna do a little something different tonight, because normally what we have folks call in, and I just want to ask Connie before I go to Chief Bindi and Victor, because I know how important folks need information, continue to provide information. I know there's so many people out there again, and I hate to be redundant, that's still on the fence about this virus. So what I want to do, I'm going to ask Connie to give us a couple questions that people have on our line. Connie, can you give me a few questions that they have for our doctor?
Okay, Carmen Martinez would like to know, how do I register to take the Johnson & Johnson vaccination?
So unfortunately, I don't think, like I said, we are not in a position yet where we can take the vaccine. I think when you're trying to make an appointment either at the county site or the state website, when you get there, it depends on what they have available in stock. It is possible. I do know some people have been able to get a choice, but that was just by sheer luck because they happen to have both vaccines in stock. Given the issues we've had in supply, you might not be able to say that you just want J&J.
Victor,
Right.
can you possibly add on to that?
Right, we're going to let Victor Cote answer that question, Victor, in reference to the vaccine.
For those, good evening, Mr. Orange. Thank you, Mayor. For those individuals who are interested in getting the Moderna vaccine from East Orange, Irvington, and parts of Newark, it's advisable that they register at sscovid.org with the Essex County Health Department. They are providing Moderna vaccine at this time at 2 sites, Essex County College in Newark, as well as the Donald Payne Senior School of Technology on West Market Street.
Okay, Wendy Bowen Martin wants to know, why is it so difficult for educators and senior citizens to receive an appointment for administration of the vaccine in East Orange?
Well, we have asked our seniors residents to register with the Division of Senior Services of the Health Department. If they are registered with them, whenever the vaccine is available, we'll call them up and give them a priority to receive the vaccine. And once they are registered, they definitely will receive the vaccine. Others who are not seniors can call the health department directly at 973-266-5480 to register with our front desk. and also, once it's available, we would call them and schedule them for vaccination.
Okay, and this is, you know, a question that's come up quite often from Florence Judah. She'd like to know, is the vaccine free? And when you address that question, also talk about what documents you may need to bring, ID, or if insurance, and why you may need to bring insurance.
Okay, the vaccine is free, but there is an administrative fee attached to the vaccine. So, the administrative fee, I believe, is $16 for the first dose and $28 for the second dose. You need to bring in your ID and any insurance document that you may have. Those are the two requirements, definitely.
Okay. Now, Mayor, actually, Deborah Thomas asked that you repeat the numbers in the wards, well, in the 4th and 5th ward, but maybe you can repeat the numbers in all 5 wards for those who may have missed them.
Okay, yes, Deborah, let me repeat them very quickly. I normally go over the numbers at the end of our meeting, but I'll do them very quickly. In the first ward, we have 916. The second ward, we have 921. In the third ward, we have 1,061. In the fourth ward, we have 1,008. In the fifth ward, we have 1,135 positive cases.
But that covers the questions on Facebook.
Oh, that's the covers? Okay, we're gonna go back to our doctor. So Doc, normally we, when this pandemic first, hit us, we had so many questions. I guess, people starting to really chime in and has chime in, and there's a lot of information out there in terms of the vaccine now. But let me ask this question. Although the vaccine is out there right now, how important it is for us to don't get too relaxed. I know that the governor and the CDC is starting to, open up and allow, a little more leniency towards, going into restaurants. We're soon starting to see our schools opening. We're going to start seeing that you can go back into the gyms at 50%, and then I know that number probably go up. Is that resulting from the number of people that has been vaccinated, and the CDC and the state of New Jersey and throughout the nation starting to see these numbers drops? And the second question is, how important it is to all of us, don't jump the gun. Continue to wear those masks, continue to practice social distance. People are very happy that they're able to go and be around their loved ones and be around their family members. But this, from your experience, what should we be doing? Right.
Right, so that's a lot. So it's a combination. So getting back to your first question about states and the CDC and everybody just gradually opening things up, it's a combination of things. So we are getting a lot more people vaccinated, although I will say we are nowhere close to having enough people vaccinated to just open everything up. That's first. Second thing, there is a tipping point at which people also have to keep, restaurants have been shut down for for a year. Movie theaters haven't really worked. So a lot of small businesses have completely, gone out of business. We are trying to balance two things. We are trying to balance public safety. So trying to gradually open things bit by bit, because we have somewhat of a protection with the vaccine. Plus the weather is getting warmer. It gives more people to have outdoor opportunities to keep doors open, keep windows open. My kids have been, at home for a year at this point, because my home district, Mount Prairie, we still haven't opened any of the classes for in-person learning yet. So hopefully in April and stuff, as the weather warms up, windows will be open, it will make it less risky. But, and I say but, it does not allow us to drop our guard. Because, this world, we live in a world where the entire world is connected. There are concerning signs with other, viruses change and evolve over time. That's part of nature. We don't want any of those viruses to come and set up shop within the U.S. if we can help it, and and occur and cause further havoc than we already have. So it's really important for us to continue wearing masks at all times. And by masks, I mean masks that actually cover your face, not a chin guard, because it makes no sense for you to have a mask that covers your chin, or you take it off your pocket and put it right back on, as I've seen many people do. And even if you're vaccinated, the CDC has said everybody who's fully vaccinated can have like small groups, but it doesn't allow you to have a big party with 100 people. I think what vaccination allows you is to maybe mix with your family, or for seniors to then go to their grandchildren, stuff like that. So smaller things to help you feel more connected, but not enough for you to have a full-fledged party with everybody indoors unmasked. Baby steps.
Right, and thank you for that. What I want to do, Doc, is I'm going to allow Victor, because when we're talking about this vaccination, here in the city of East Orange, we have been, in the last few days, in partnership with the county, and we're starting to go into our senior buildings and doing vaccinations that we know that is very important. And plus, it is a very convenient way for us to go into buildings where our seniors don't have to leave the buildings, and they can come right in their hallways, and we have the nurses, we have the practitioners and the folks right there. And we witnessed that yesterday, how so many people, and one of our buildings on 111 Munn Avenue was very, very happy about that. They didn't have to leave their facility, their homes, and we went on every floor. We started from the 9th floor on down to the 1st floor, where people was able to get vaccinated and get the vaccine. So I want Victor just to talk a little about, our initiative here in the city of East Orange, and we was able to launch our mobile clinic truck today. It was our launch today, and to us, it is another way of us making sure that we go to the front doors of our constituents, especially the seniors and those who are the shed-ins who can't get out. So we'll take the mobile clinic truck right to that address, administer the vaccine to these folks. So again, bringing down that population when it comes to this COVID. So again, I'm gonna let Victor just talk about that a few minutes. And if you want to chime in, Doc, you're welcome to do that. So Vic, just give us an overview on the vaccine and the vaccinations areas and places that we have.
Beginning this week on Monday, Tuesday, we have been to 4 senior buildings, vaccinating senior residents in collaboration with the Essex County Health Department. And these seniors received the Johnson & Johnson vaccine. So if you are a senior in one of the senior buildings in East Orange, please call the Division of Senior Services at 973-266-8832 to get yourself registered. If we do have vaccines, we would endeavor to bring them to your buildings. We still have that collaboration with the Essex County Department of Health. Also, we also partnered with the NCHC, the new East Orange Primary Care, to vaccinate some of our residents at the Campus High Auditorium that was set up for that purpose. And this was done same day that the senior buildings were done. So please, if you want to get vaccinated, again, call the health department, 973-266-5480. And for those that want to use the NCHC, you don't have to be a senior. As long as you are eligible, you can receive vaccination at the auditorium. Also, we are asking that our homebound seniors, please call the Division of Senior Services, 973-266-8832 to register. We are making plans to vaccinate our homebound seniors, not just those in the senior buildings, but also those in their own homes. We're making plans. We already have, the mayor already mentioned that we have a mobile truck that can go from building to building, house to house, and we're planning to use that as our platform to vaccinate as many seniors in their homes as possible. So please call the number 973-266-8832 to register. This is the number of our Division of Senior Services. Also, the city is also working to establish and create a website for registration, so that we will have our own registration website that our seniors can go and just register for vaccination. Instead of calling the senior services, they can register at that website. It will be right in the city website, and it will be accessible to everyone that wants to use that site. Also, now we are making arrangements also to vaccinate our residents in the emergency shelters. We have provided names and addresses of our shelters in East Orange to the Essex County Health Department. Hopefully, they would be in a position to help us to ensure that our emergency shelters, residents are vaccinated as well as their staff. This would help to ensure that our shelters are safe, for whoever is coming to reside there. And also, please, if you are eligible for vaccination, regardless of age, as long as you are eligible, you meet the criteria for vaccination, you can be vaccinated at the Essex County sites in Newark, the Essex County College Gym, as well as the Donald Payne Senior School of Technology.